This is my audience.
Donna. Kate.
Shelby.
David.
Debbie.
Tom.
Hello, everyone, and thank you for coming. My name is Dana, and today I'm going to talk about communication barriers for individuals with traumatic brain injuries. Have you ever taken a moment to think about what it would be like to be unable to communicate your wants and needs? Maybe because you cannot find the right words, or simply because people are unwilling to listen to what you have to say, or maybe you're unable to use your verbal voice at all. This can be the case for many people with traumatic brain injuries. In order for us all to better understand the barriers and challenges these individuals may be facing on a daily basis, I will define what it means to have a traumatic brain injury and cover some of the common communication misconceptions and barriers. So what does it mean to have a traumatic brain injury? Traumatic brain injury, also called acquired brain damage or injury or head injury, also known as TBI, occurs when a sudden trauma causes damage to the brain. Communication disorders are common in individuals with TBI. How is the brain affected? An injury to the head may cause traumatic brain injury. There are two major types of TBI. The first is penetrating injuries. In these injuries, a foreign object, such as a bullet, enters the brain and causes damage. This localized damage occurs along the route the object has traveled. Symptoms vary depending on the part of the brain that is damaged. The second is closed head injuries. Closed head injuries result from a blow to the head, such as a car crash, when your head hits the windshield or the dashboard. These injuries cause two types of brain damage: primary and secondary damage. First is primary brain damage, which is damage that is complete at the time of impact and may include skull fractures, contusions and bruises, blood clots, lacerations, or nerve damage. The second is secondary brain damage, which is damage that evolves over time after the trauma has occurred and may include brain swelling, increased pressure inside of the skull, epilepsy, low or high blood pressure, too much or too little carbon dioxide, cardiac changes, lung changes, and nutritional changes. Next, we will discuss how communication can be affected with an individual with a brain injury. Communicating with someone who has a traumatic brain injury may include how they receive, process, and channel information. People with a brain injury often have cognitive and communication problems that significantly impair their ability to live independently. These problems vary depending on how widespread the brain damage is and the location of the injury. Brain injury survivors may have trouble finding the words they need to express an idea or explain themselves through speaking and/or writing. It may be an effort for them to understand both written and verbal communication, as if they were trying to comprehend a foreign language. They may have difficulty spelling, writing, and reading. The person may also have trouble with social communication, including taking turns in conversation, maintaining a topic of conversation, using an appropriate tone of voice, interpreting the subtleties of conversation, such as the difference between sarcasm and a serious statement, responding to facial expressions and body language, keeping up with others in a fast-paced conversation. Individuals may seem over-emotional or flat. Most frustrating to families and friends is often that the person may have little or no awareness of how inappropriate he or she may be acting. In general, communication can be very frustrating and unsuccessful. In addition to all of the above, muscles of the lips and tongue may become weak after a TBI. The person may have trouble speaking clearly, The person may not be able to speak loudly enough for others to hear, and muscles may become so weak that the person is unable to chew or swallow their food. Now, let's discuss the different ways to communicate with an individual with a traumatic brain injury. First, we need to remember that appropriate etiquette is based primarily upon consideration and respect. It is important to relax and treat the individual with dignity and respect. Be sure to listen to the individual and treat adults as adults. Do not be afraid to ask questions when you do not understand what is being said or what is being asked of you. Also, be prepared to repeat yourself. Some people with TBI may have short-term memory loss. Be patient and supportive. Take time to understand the individual and be sure they understand you. Try to avoid interrupting the person, and if you are speaking in a busy location, consider moving your conversation elsewhere if possible. Some individuals with TBI may have difficulty tracking and concentrating on your conversation. So we can conclude that not everyone who has suffered a brain injury will experience the same communication barriers. However, no matter the disability or severity of disability, everyone deserves the right to be heard. In summary, I have covered the basic concepts of understanding communication barriers for people with traumatic brain injuries and how to overcome some of those barriers. Now, having a better understanding of communicating with somebody with a TBI or traumatic brain injury, you can be aware of these potential barriers and consider how to better communicate.